If you have ever been confused about the difference between a transabdominal scan and a transvaginal scan, this video will clear it up better. As a sonographer, that's one of the most common questions I get in the scan room. Hi, my name is Chinasa. I am a medical sonographer, and on this space, it is everything ultrasound. Today, I'll explain what a transabdominal scan is, what a transvaginal scan is, when each of these scans are done, and why we choose one over the other. And at the end of this video, you'll be able to understand them better. What is a transabdominal scan? A transabdominal scan is performed by moving the surface of the probe on the surface of your skin or the abdomen. Emphasis on the surface after the gel is applied. Usually, if a pelvic scan is inclusive, you will require a full bladder for the scan. This full bladder acts as an acoustic window to move bowel loops out of the way to avoid gas interference and enhance better visualization. When do we use a transabdominal scan? Usually we use a transabdominal scan for general abdominal assessments, for general pelvic evaluation, for large fibroid masses or abdominal masses, for routine pregnancy scans, second trimester, third trimester, and even first trimester as well. We also use it to visualize the uterus and the adnexa. And the advantage of a transabdominal scan is the fact that it has a wide field of view. That is, it covers a larger area on the abdominal region. Also, it is more comfortable for patients and it is more ideal for second and third trimester ultrasound scans. The limitation is the fact that it is not very detailed in early pregnancy, follicular tracking. The image resolution, that's the appearance of the image, will also be reduced in obese patients, and also bowel gas can interfere during the course of transabdominal scan. Now, what is a transvaginal scan? A transvaginal scan is a scan that is performed by inserting a high-frequency probe into the vagina of the patient to obtain clearer images of the pelvic region. It is basically used for only pelvic evaluation, and it requires an empty bladder for the scan. Unlike a pelvic scan that requires you to have a full bladder, for transvaginal scan, you do not need a full bladder for the scan. Actually, you will even be asked to empty your bladder before the scan, as a full bladder can distort the pelvic anatomy. It can also make the patient uncomfortable during the course of the scan. Now, when do we use a transvaginal scan? Usually, we use a transvaginal scan for pregnancy scans that are still early, usually less than 10 weeks. We also use a transvaginal scan when we suspect ectopic pregnancy. We also use a transvaginal scan for follicular tracking. It helps visualize the ovaries, the uterus, and the endometrium better. We also use it for cervical length evaluation and for pelvic pathologies that needs more evaluation or more review. What is the advantage of transvaginal scan? Usually the image resolution is better. That is, the image appearance on the ultrasound monitor is clearer in transvaginal scan. It also helps to visualize early pregnancy better, the gestational sac, the yolk sac, and the fetal pole. For early pregnancy, transvaginal scan is usually more clearer. It is also important because of the close proximity to the pelvic organs and the uterus, and it makes pelvic assessments even more better and more detailed. What is the limitation of this transvaginal scan? Usually the field of view is smaller. It is only limited to pelvic scans. That is, you cannot use a transvaginal probe for any other scan other than a pelvic scan. It is also uncomfortable for some patients, and then it is not used for, or it is not ideal for pregnancy scans within second or third trimester. In some cases, or in most cases, we usually use both. We can start with a transabdominal scan and then conclude with a transvaginal scan. It is not that one is better than the other. It is just that they both answer different clinical questions. For instance, for a pregnancy of 6 weeks, if we don't see anything using the transabdominal probe, we can ask the patient to go for a transvaginal scan instead to get a clearer image. I've had a situation where a patient did a transabdominal scan for a 7 weeks pregnancy. The fetal pole was seen, that's the baby was seen, but cardiac activity was not seen. I had to ask her to do a transvaginal scan for just second opinion or follow-up. And then during the course of the transvaginal scan, the fetal cardiac activity was detected. That means it was simply not clear on the transabdominal scan, but clearer on the transvaginal scan. Then for an anomaly scan, a transabdominal scan is obviously better because as the pregnancy advances, a transvaginal scan is no longer required as it has a smaller field of view and will not give detailed information during the course of the scan. In the case of suspected ectopic pregnancy, a transabdominal scan can be used first, and then a transvaginal scan can also be used for additional information or confirmation. In the case of fertility scans, usually a transvaginal scan is the scan of choice. So you can see that one is not superior over the other. They both have their advantage and disadvantage. Some of the questions I get about transvaginal scans are, number one, is it painful? Usually a transvaginal scan should not be painful. You might experience mild discomfort, but it is not a painful procedure. The second question is it safe for early pregnancy? Yes, it is completely safe and it does not have the ability to cause miscarriage because most patients are scared that the insertion might cause a miscarriage. The insertion of the probe into the vagina does not have the ability to cause miscarriage or harm the baby. So transvaginal scan is very safe during early pregnancy. The third question is, can I refuse a transvaginal scan? Of course, you can refuse a transvaginal scan, but you should also understand that it also limits your diagnostic accuracy. So if your sonographer or your doctor has requested for a transvaginal scan, they have their reasons for doing so. Please make sure you adhere to them because it gives better diagnostic accuracy depending on the reason or depending on your request. So in summary, the key difference between a transabdominal scan and a transvaginal scan, number one is the location. For transabdominal scan, it is on the surface of your skin. For transvaginal scan, the probe is inserted into the vagina. The second difference is the resolution. For transvaginal scan, the resolution is higher and better. When I mean resolution, I mean the appearance of the image. Transvaginal scan has a better resolution than a transabdominal scan during pelvic investigations. The third difference is the field of view. A transabdominal scan has a larger field of view. That means it can cover the general abdomen, larger masses, larger fibroid masses, and all of that. But a transvaginal scan is limited to only a pelvic scan, limited to only the pelvic region. Lastly is the examinations required. Transabdominal scan can be used for a wide range of examinations from pregnancy to pelvic to abdominal scans, but a transvaginal scan is only used for pelvic assessments, for early pregnancy, and for fertility checks, especially follicular tracking. Usually a transabdominal scan is not the scan of choice if you're doing a fertility check like follicular tracking. That's the major difference between a transabdominal scan and a transvaginal scan. Now you understand that one probe cannot do everything. There are different probes for different reasons. The goal is for them to answer the specific clinical questions. Lastly, a transvaginal scan cannot be done on a patient who is currently bleeding because it can be messy. If you are currently on your menses, if you're currently bleeding, except in cases of ectopic pregnancy, suspected ectopic pregnancy, then we can go ahead to defy the odds and do a transvaginal scan for a bleeding patient. Other than that, if you are bleeding, a transabdominal scan will be the scan of choice for you because a transvaginal scan requires insertion and we don't want to leave the whole place messy. If you have any more questions you would like me to address that it has to do with the difference between a transabdominal scan or a transvaginal scan and when they are done or when they are requested for, feel free to drop it in the comment section and I might just make a video about it. If you found this video helpful, don't forget to like, share and subscribe and I'll see you in my next video. Bye.